Welcome to my channel. Hi guys, welcome back to my channel. So today we're going to go through, I'm going to show you how it is that we screen an adult. So this is my patient, or she's going to pretend like she's my patient. She's my friend Kabari. So yes, basically this is the adult room. As you can see, this is like our table. This is where I sit, and the patient across me. Of course, our masks should be in. Covered. It's just that now you'll not be able to hear me. And there's our examination table. So yes, first things first is you ask the patient. You can see it's a female, and then you ask the patient how old is the patient. So I'll just do it as I normally do it with the patient, and then you'll be able to see. So yes, how old are you, ma'am?
I'm 20 years old.
20 years old. Okay. And then you ask their age, and then you ask for, complaints. So first it's age, and then you obviously say, okay, a 21 or a 20-year-old female patient came to the clinic with the various complaints. Then you ask, okay, what are her complaints?
Productive cough.
Okay. Do you know what is a productive cough, ma'am?
Yes.
Okay, so you see, you have to ask this because some patients can come saying, my urine is warm or my heart is jumping out. Some people Google and they come with so many things. So you have to ask the patient just so you understand exactly what it is they are trying to say. So after you ask for the complaint, then you ask how long has it been. So that is duration. So how long has it been?
Since Monday.
So since Monday. So today is let's assume today is a Friday. So that will be like 4/7. So it's like 4 and then over 7 as in a week. So yes. And then from there, the duration you ask for allergies. Are you allergic to any medication? For allergy, we ask specifically for medication, not for food and other things. We just want to know, is it maybe penicillin? Is it, any type of medication? Are you allergic to any medication?
No.
Okay, she's not allergic to any medication. And then after that, for a female, you ask when was their last menstrual, cycle or so. And then you ask, and then she will let you know. Sometimes they may say maybe it was somewhere in August. I don't remember the last day or so. But it is necessary to always make a pregnancy test. Sometimes the patient may not come in with normally, or the protocol, I don't know, it depends on various hospitals. Sometimes they do a pregnancy test only when the patient has lower back pain, nausea, vomiting, or portraying, symptoms of pregnancy. But in this case, our protocol is to always do a pregnancy test for any female, just to rule that out, and also just the standard procedure. So after the pregnancy test, and then you ask for any medication history. Are you on any chronic medication? Are you on any chronic medication?
No.
So she'll say no, then you just write none. Any surgical history? Have you been operated before?
Yes.
Okay, when?
2019.
2019 for what?
Breast lump.
Breast lump. Okay, so you write there breast lump, and then you write in brackets the year. So that just tells you, we need to know the patient's history. Because for adult screening for a clinic, they just come in and then they go. It's like a day patient. It's not like in the wards where the patient will be admitted there and then you have their history and everything. So after you ask for the surgical history, you can go ahead and then you ask for employment history. Sometimes this can let us know, okay, employment, what's their job? Perhaps they are mechanic, they are plumber, and then like she came in with productive car. Perhaps she works even in a butchery or something, and the environment is cold. So this will help us also, to formulate a diagnosis and also help us with the correct treatment as well. That's why we ask for employment. Then you go ahead and then you ask for smoking. Do you smoke?
No.
Do you drink alcohol?
No.
Okay, so you ask all these things so that they can also help us draw up a diagnosis and also a treatment plan. After you're done asking, do you drink, or do you smoke, then we go to our, observation or on examination. We call it on examination. That is where okay, she has productive cough. So I have to check that she perhaps have tonsils. Or I can also auscultate, use a stethoscope to listen to her chest, whatever it is. Maybe the patient has rash, so I'll let the patient lay down and then I check on examination, are they stable, are they communicating, how do they look like. It's basically what you see with your eyes right now. That is what you write on examination. Then after you're done, then you write your diagnose, and then you write your plan which would be like the treatment plan based on the condition. So basically that is how we screen an adult patient. It may seem complicated as I'm saying, but practice makes perfect. As long as you know that we start from the age, then we go to the complaints, the duration, you ask for allergy, you ask if it's a female, you ask when was the last menstruation cycle. After that, you go to the medical, then surgical history. From surgical to medical, you ask for employment, if they work, and then you ask for what's the last thing? You ask for if they drink or they smoke. Then you do your examination, and then you diagnose, and then you treat your patient. And of course, don't always forget to give health education, register your patient, ask for their cell phone number depending on your hospital policy, and then you can always come back, and should there be anything, maybe it's blood tracing, whatever it is, you can always call the patient and be like, oh, you didn't come in for your results, or you forgot to pick up your medication from your pharmacy and all that. So yeah, basically this is how we screen an adult patient. I hope you guys enjoyed this video. Make sure you comment below on what's the policy in your hospital, or whatever it is that you're taught at school, but basically this is what you're doing. Thank you for my friend for pretending to be my patient. I'll see you in my next video. So yeah, bye.